It Mifsud very well, but
Good morning, Your Excellency. Good
Sandra.
morning.
Okay, hi Sandra. Good morning. Good morning. Well, I hope you have been enjoying these couple of days, not just working. I hope that you've been a bit around. Now summer has really kicked in before the 21st of June. Until a few weeks ago, we thought that summer will never come to Malta, but climate change is affecting Malta too, and I'm sure all our countries within the Mediterranean and Europe. So I would like to extend a warm welcome to friends and colleagues from Europe. I have had the pleasure to address you at the opening of a previous meeting, which was also held in Malta on the 9th of March 2020. I was thrilled to know that since 2020, you continued researching and working together on peripartum depression, and that now you have successfully moved forward in your research and have published scientific papers disseminating very interesting outcomes. I would like to congratulate you for the work you have done so far and augur much more success in your continued endeavors to bring forward new data and findings to this important subject matter under research and discussion. I am aware that the main goal of Riseup Action, Cost Action, is to establish a pan-European multidisciplinary network of researchers dedicated to the understanding of peripartum depression disorder, right from its prevention and assessment to its treatment and global impact. Well, as an avid advocate for the well-being of children, this is particularly important to me, as I believe that the prospects of a child's well-being is molded from the very beginning of life. I consider mental health as an important social determinant of health and fundamental to the lifelong holistic well-being of children. I'm therefore a believer that peripartum depression disorder must be addressed at all costs, not only from a rights-based perspective, social consideration, but also from an economic perspective. And maybe I bring in the economy because of my other life in politics. Politicians do understand much more than any social and than any other perspective or a respect of things from an economic perspective. So let's also be strategic in the way we communicate these things. I also believe that mental health must be at the heart of all policies that our authorities develop to ensure the rightful dignity of every person and the necessary sustainable prosperity for all of our societies. Several studies show that a mother's mental health during pregnancy and the first year postpartum is of the utmost importance, not only to the physical and mental health of children, but also to the cognitive, social, and emotional development of the child. As we all know, the long-term adverse effect of perinatal mental health on women and their children and families includes incurring substantial ongoing economic and personal costs, which can also create a cycle of poverty, coupled by social exclusion and early school leaving, amongst other negative consequences. No society and no country can afford to be complacent on issues of mental health, and in particular, when preventive measures are available to curb the devastating consequences left by unaddressed mental health matters. In this context, I would like to quote from a position paper by Karen Hazel-Rain et al., who states that, and I quote, a significant proportion of the cost of perinatal depression relates to adverse impacts on the child, most likely mediated through impairment to the mother-infant relationship. Rain goes on to propose that perinatal depression screening should be carried out to precisely detect vulnerable mother-infant relationships, parenting, maternal mental health, and infant psychosocial and psychological development. On the other hand, Sharon McNabb has called perinatal mental health the silent pandemic and noted that we are becoming more aware of the intergenerational impact of common perinatal mental disorders. I'm quoting from only 2 studies, but there are many more studies, which I'm sure you're very much aware of, that report a direct relationship between peripartum mental health and the social conditions affecting children. From my very own first-hand experience, I have met and meet families who have suffered because of peripartum mental health issues, where the consequences are devastating on their children who experienced late cognitive development and fell back in their education and subsequently cannot secure an adequate living income to sustain themselves and their families. In this context of what research shows us, and also from a first-hand experience perspective, I call on European health authorities and all policymakers within the EU member states to provide peripartum mental health screening where this is not already available, and provide the necessary resources for its thorough implementation. Research is already showing that early detection and timely intervention in peripartum mental health screening is the best practice. I consider peripartum mental health screening as a crucial tool for the prevention of the consequences of peripartum mental health. I also consider it to be a most effective tool for the prevention of intergenerational poverty and all the suffering it creates. I encourage more research to be carried out on the benefits of peripartum mental health screening so that you can provide scientific and undisputed evidence on which policymakers can base their decisions. I encourage you, as researchers and experts in this crucial topic, to focus also on the social consequences of peripartum mental health issues and its effect on the well-being of the child, the families, communities, and society in general. Now that COVID-19 have brought mental health to the forefront, let us keep this momentum in all spheres of mental health. I am pleased that the European Commission, through its Child's Rights Strategy and the Child Guarantee, which are historic instruments for the European Union, has given visibility to the mental health of all children. I therefore augur you that as active members of Riseup Cost Action, you will continue to seek to bridge multidisciplinary knowledge on determinants of depressive symptoms in the peripartum period and the mechanisms of action and change. The holistic health of every mother and child is essential to ensure the well-being of all of society, and is undoubtedly a socio-economic investment in the well-being of our communities. I thank you, and I augur you much constructive discussion and further endeavors to continue to give visibility on this very, very important subject. Thank you.